Welcome back and welcome to Health and Nutrition. This will be illustrated here on Women's Worldview by Dr. Lalita Kaul, who is a well-known professor at College of Medicine, Howard University. The moderator here is a renowned gentleman by the name of Dr. Shambhu Banik. On this set, Dr. Banik questions Dr. Kaul on healthy heart. Let's look, let's listen, let's learn, and let's take care of our hearts.
On behalf of Global Television Network, it is my again great pleasure and honor to welcome, by popular demand, Dr. Lalita Kaul, Professor of Nutrition in the College of Medicine, Howard University. Professor Kaul, welcome back
Thank you.
to Global Television Network.
Thank you.
As you know, she has already covered 4 sessions on nutrition and health. This morning, we are going to touch on one of the most important topics facing the world, heart disease. Professor Kaul, from your extensive experiences and research, could you share with our viewers some of the risk factors for heart disease?
There are several risk factors. They are controllable and non-controllable. Of course, the non-controllable are genetic factors, and we are born, the family history, and genetic makeup. If you are from the Asian descent, we have different, which I will talk later, but the non-controllable ones are smoking, too much alcohol, I'm saying too much, and diet which is high in saturated fat, cholesterol, and also lack of exercise, sedentary lifestyle, and very high risk factors. And under the fat comes several sub-factors which we'll talk around this, which especially Indian Americans are prone, but people in general. So these are controllable: diet, exercise, stress, and these are the controllable environmental risk factors.
You mentioned cholesterol. Could you enlighten our viewers about, I understand there are several kinds of cholesterol. Some are good, some are bad, you know?
Yes. Usually when the patients come to see me, they say my good cholesterol is low or my bad, this is how they know. So I want to say in very simple terms, and cholesterol is natural. We are born, we make about 80% in the body. Even a newborn child, you'll see, will be cholesterol. It is when it is in excess, we take too much from the food, it gets deposited in arteries. And as a result, it can prevent for oxygen going back and forth from the heart. And it can cause heart attack or other heart-related issues. There are 3 kinds of cholesterol. One is total cholesterol, overall cholesterol. You will see on the numbers in your lab reports, it will run 150, 200, 240. But now the guidelines are from American Heart Association, it should be less than 200.
Less than 200.
100 milligrams. And in people who have more than even one risk factor, it should be below 150. So if you have any risk factor, family history, or you are smoking, alcohol abuse, then the good cholesterol, HDL, what it means is
what HDL stands for?
High density lipoprotein. So they can HDL, and it is a good cholesterol. Now we want this number to be higher, total cholesterol to be down. And if you have this number low, less than 37 milligrams, it's a big risk factor. And in our community, Indian or Asian Americans in general have very low HDL. The moment I see the lab report, I see HDL is low, it's a risk factor. And then the bad cholesterol is LDL, which stands for low density lipoprotein. And if the numbers are high, That means you are, the cholesterol is sitting there in the arteries along with other things, calcium deposit and others. So arteries are becoming harder to take the oxygen back and forth. So the new guidelines is less than 100 milligrams, and before per deciliter, before it was under 30 UR, but even one risk factor, it has to be below 70. So this is the bad cholesterol. Now there is another factor we don't talk as much is triglyceride or
that's what I want
TG
to ask you,
later.
yeah.
Okay, go ahead.
Go ahead.
Question?
What is a triglyceride?
It's a triglyceride is total, triglycerides is, it's like a vehicle which takes cholesterol around the body. It's like a little bus is going, and these are X receptors. It's a kind of fat. And if there are high triglycerides, then it's a risk factor. Especially Asian American community have high triglyceride. The profile is high triglyceride, high LDL and low HDL, and then on top of it, if you have diabetes, overweight, it's a ticking bomb. So triglycerides are also a risk factor, high triglycerides.
You mentioned that Asian community, including Indian American community, has got high LDL, correct?
Yes.
Okay. Now, is it a cultural factor, genetic factor? What is the reason for that?
Well, it is genetic and environment factor combined, and this is how. Genetically, Indian Americans or Asian Americans in general, Bangladesh, Pakistan, our arteries are narrower than Americans, and as such, any little disturbance, it gets deposits. Plus, we have another sub-factor, ApoB cholesterol, which is higher. Cholesterol is again fractioned into several, and that can cause it. So this is what the Asian community has, narrow arteries and subfraction of cholesterol is high. And so this they cannot control, is genetic, but then what they can control is risk factors. If they are smoking, if they are drinking more than enough, more than really alcoholics, if they are leading sedentary life, I don't mean one has to go on marathon running, it could be just walking in your apartment or around your grounds of the house. And if you don't modify, the combination of genetic and environmental become very potent. So as we get older, then the arteries get harder, and you have to take a lot of medications to keep the flow of oxygenated blood.
Now, I know that you have written recipes, you have written books, you have articles for healthy heart. Could you share with viewers what are some of the important ingredients for healthy hearts?
As I have written, I have 2 books. Another one is Multidisciplinary Approach to Obesity, and this one is Healthy Heart South Asian Diet. I have given substitution. Each recipe, for example, favorite food among non-veg is butter chicken.
Butter chicken.
Butter chicken, I see, so they love it. So I took the same recipe, and instead of putting so much butter or ghee, in India they'll put it, you just put buttermilk, low-fat buttermilk, and and all the spices. So the taste, I've tried, the taste comes same. Or kheer. So many of the places, parties you go, you'll say, well, I made it from half and half. So that's a lot of fat. Even though some people might say, I don't need to worry, I don't have it. But we want to take prevention is very important. So instead of half and half, just substitute 2% milk. And in fact, only 2 weeks ago, I tried kheer with fat-free half and half. And I took to office and shared with my Indian colleagues. They say, it's so rich, it's so good, and I put nuts. I said, well, it's fat-free. And so you can make the delicious food. So these are the two examples of a dessert and non-vegetarian. And a fish recipes, instead of like I am originally from Kashmir, we deep fry and then cook it in different sauces. So then I said, how do we do? So I just bake the fish with the masala, and when it's crisp with a little spray, and then put in the sauce. Because deep frying is going to absorb so much oil. So the modifying in the books, I have given some examples of vegetarian, non-vegetarian desserts. How can you make a healthy diet?
In India, and Indian Americans in this country, they use varieties of oils.
What is that?
Varieties of oils.
Yes,
cooking.
yes.
Coconut oil, groundnut oil, mustard oil, some people use ghee and all these things. What is your suggestions for Indian Americans to lower the risk of heart disease by using oil?
Oil is what I give you on the basis of scientific research, you know, is that we should use not saturated fat in cooking, like your butter, lard, ghee, because that gives rise to alcohol, rise to cholesterol. So what I suggest is oil, and we want to use monounsaturated. Monounsaturated means they are lacking only 2 hydrogen bonds. And so the best for frying is canola oil, which is vegetable canola is frying. But for general cooking, olive oil, which is monounsaturated, and for sauteing, cooking salads is olive oil or safflower oil, but frying canola oil. So the oil is the best way of cooking.
How about ghee? You know, it's a very popular.
Oh yeah, ghee. Ghee is it's a saturated fat, and what I mean by saturated fat is the oil when they introduce hydrogen bonds and it starts getting hydrogenated, so it becomes solid. Like we don't see now Crisco in the shops or anything. That gives rise to cholesterol. So we want to take every little bit to prevent cholesterol accumulation in our arteries.
Now we have got 1 minute left for this segment. Could you summarize in 1 minute about the way that we can maintain healthy heart?
Healthy heart, yes. Keep your weight within reason, not meaning skinny skin, whatever you are. Exercise, you don't have to be marathon runner, but if in your daily schedule you can include exercise and follow a healthy diet, unsaturated, low in fat, high in complex carbohydrates, and eat, don't starve and eat one meal, eat every 4 or 5 hours.
Well, thank you very much for enlightening us with your beautiful explanation how to maintain healthy hearts. I think that Indian Americans will be very happy and they will be tuning in to listen to your presentation this morning.
Thank you.
Thank you again, Professor Kaul.
Thank you.
Thank you.